Here we go.
You're tuning in to Will Love Listen. Now listen.
So everyone, today we are going to be talking about all things cosmetic, body sculpting, and alternatives to plastic surgery. And I'm very excited to have with me here Dr. Tameem. I've been going to him for a couple of months now. I've been hearing about him, though, for quite a long time. And today's conversation is going to be primarily on how you could get your ideal face without having to go under the knife, or at least without having to go under anesthesia. So I'm very excited about today because I know from shows that I have done where I touched upon skincare and plastic surgery, they get a lot of listens. And typically on the Will of Listen podcast, I'm always having celebrities on, whether it's people from reality TV, people who are actors, well-known musicians or comedians. And I was surprised when I did like a couple shows that were more so on like personal subjects like cosmetics and plastic surgery, et cetera, that they got a lot of hits, they got a lot of listens. So I'm very excited to have you here today, Dr. Tameem, especially as we're entering the holiday season. And I know everyone wants to look good for Thanksgiving, Christmas, New Year's, and just in general as we make our way into 2024. So let me shut up and you can introduce yourself.
No, thank you so much for having me, Will. It's been a pleasure getting to know you, and I'm so super excited to have this conversation about alternative treatments to cosmetic surgeries and in aesthetic medicine itself. I'm the medical director of Hello Hydration. I've been in this field for about 8 years now. We have 3 different locations all across New Jersey, in Paramus, Hoboken, and Secaucus, New Jersey. The Paramus one is at the Garden State Plaza, which everybody in New York and New Jersey knows because this is where we go for all the shopping. So I'm super excited to be here, and I thank you very much for taking the opportunity to speak with me. So thank you.
Oh, you're welcome. Absolutely. And we could talk about some of the stuff I'm doing. But first, before we start getting into, all the juicy conversation, I want to start off by finding about your background. So where were you born? Where did you grow up? And could you tell us how you got into this field and became a doctor?
Yeah, sure. That's actually a great question. So I was actually born in India. I lived there till I was like 14. I came here at 14. I finished my medical school, so I, graduated high school and everything else. I went to a GPP program. I finished my med school at the age of 23. And I realized I was a very young age, and I actually ended up going to work in pharmaceutical industry for about 3 years or so after that. Because, I was so young, I realized I didn't want to go to residency. I felt like I didn't have the whole college experience. Trust me, I'm not smart. I'm just Indian. That's what it is. But I'm just joking. But so I wanted to have more of that life experience. So I worked in pharmaceutical industry with a company called Boehringer Ingelheim for about 3 years. That's when I was actually initially introduced with the concept and the idea of aesthetic medicine. I worked with a lot of different physicians that were senior to me, people that mentored me, that worked in this field. And when I then eventually went for residency, I did my residency in family medicine. From my first year of residency, I started doing injectable treatments, aesthetic treatments with Botox and fillers and everything else. I had an amazing associate director. He still practices in New Jersey, that gave me the opportunity to experience with some of these alternative treatments. And while I was in my residency, I took the opportunity to do a lot of derm rotations and plastic surgery rotations, getting to learn the field of aesthetic medicine. So when I came out of the residency, I was already with a great knowledge of aesthetic medicine. And that kind of gave me a catapult in initializing my career in aesthetic medicine at that point. Because, a lot of times I feel like, people don't have that unique experience. I appreciate my colleagues that are in derm. I appreciate my colleagues that are in plastic surgery. And I always tell my patients all the time, I'm not a plastic surgeon. I cannot guarantee the results a plastic surgeon can do, but I guarantee you they can guarantee the results I can do. Because I can do this, because I do this every single day. I play with injections every single day, and I love the experience of that. And I'm able to give the experience every single time with my patients. So just a little bit about me and my experience. I've done all my residency in New Jersey. I went to St. Joe's. I did my fellowship in preventative medicine as well. After that, and the rest is the history, where I just kind of realized that this is the field I really love. I've always been artistic, and this has always been the part where I was able to utilize my art, utilize my skills, and have the eye of aesthetic medicine, because not everybody has that. Be able to create beautifully natural results, because I feel like that gets missed a lot in this medicine.
Yeah.
So able to not only do that, but I have all my injectors that are all trained by me from the bottom up. I always train green injectors, because I want to train them my own unique techniques, my own injection skills, and we've always had great results because of that.
You have a really extensive background, so I find that to be really impressive, especially now, because I feel like med spas are becoming trendy, and almost anyone's opening them a lot of people are opening them who aren't doctors and who don't have the background you do. So thank you for clarifying that and telling us a little bit about you. Now, Hello Hydration, you guys have 3 locations. You guys are doing exceptionally well right now in New Jersey. And every time I come to the Paramus location, you're booming. So I want to talk about this latest sort of shift into cosmetics. So for so long, I mean, people still get plastic surgery, but Botox, or rather wrinkle relaxers, because right now there are a plethora of them, fillers, and all these things like PDO threads, microneedling, radio frequency, etc. This wasn't really, booming 10 years ago, 20 years ago, etc. So could you speak on the recent surge into, your average woman or man wanting to get done all these things to their face without having to go under the knife?
Yeah, no, I think that's a great point that you bring up. And I have seen a huge shift with that in the last, 10, 15 years of just cosmetic surgery. And even in the industry, there's a lot of data points of that. And one of the biggest companies, Jeuveau, everybody knows Allergan. They spend a lot of money in data, and they talk about how much of a gravitational change that has been in the last 5 to 10 years. And honestly, more so in the last, ever since COVID. And it's honestly because of this interaction on Zoom. Everyone was at home. Everyone was looking at something on Zoom camera, and they were like, wow, what's going on over here? What's going on over here? Now, obviously, there are options to do plastic surgeries, but why would you want to do that when you can still get very great results without having the downtime, without having to spend hundreds and thousands of dollars with plastic surgery, without having to go under anesthesia, without having to be swollen for like 3, 4, 5 months sometimes. So there's a lot of things that happen with plastic surgery, which you don't have to do that with aesthetic medicine. Injectable treatments, PDO threads, RF microneedling, these are all very quick treatments without having with having a very limited downtime, and the risk to reward ratio is so much better. So I wish everybody had, $20,000, $30,000, $40,000 in their pocket. Not everybody does, but everyone wants to look good. Everyone wants beautiful lips. Everyone wants to have a very smooth forehead. And these treatments can be done with 1/10 of the cost of those treatments. And you still can appreciate how natural these results are, how beautiful these results are. Again, while you have the advent of plastic surgery, it's not like people that get plastic surgery don't do Botox. You still need to do Botox.
Yes.
It's not like people that do plastic surgery don't get fillers. I have patients that have gotten a facelift, and I still have to do fillers. I do more under eye fillers than anyone in North Jersey and New York area. And a lot of patients that do under eye bags and they do blepharoplasty, they end up having hollowness. They come back to fix it. Or X, Y, and Z treatment, they always come back to needing a little bit of the aesthetic treatment. So what I've realized that patients that are even younger population, they have kind of seen that instead of going to that route, why not just use aesthetic medicine and some of these treatments, which are completely reversible? Because a lot of times with surgery, you're committed to those results for a very long time. So whether you like the results or don't like the results, you're committed with it. With these, everything that I do is temporary, nothing that I do is permanent. So you don't have to feel like you have the commitment with it. It's funny, we live in a day and age where nobody wants commitment, and I think that's why it's booming because of that. Nobody wants commitment.
You're right. Everything is that it's really true because especially speaking of the data points, you touched upon something that I found really interesting that studies are showing this huge gravitational shift towards non-invasive cosmetic procedures. And I think that's interesting because it illustrates that people, well, one, it's partially a money factor, but more importantly, I think people are scared to go under the knife. And as someone who's had plastic surgery, it's not like a walk in the park.
No.
In April 2022, I had buccal fat removal surgery, and in May 2022, I had rhinoplasty. And the recovery, I have thick skin, so the recovery process took a lot longer than a few months, a lot longer. I was swelled up for a long time, and it was a very gradual situation where the swelling went down. I felt horrible from the anesthesia. I will say for months, I felt weird from the anesthesia, and it's just not a fun experience. So the fact that people could do things such as tighten their skin, lift their face, alter their nose, alter their lips, all of these things without having to get, chin, neck, jaw, lipo, even in some cases, avoiding rhinoplasty, avoiding a facelift, etc. I think that's amazing because it provides a safer alternative.
Yeah. And I think you hit the nail on the head. Like when you're talking about some of these treatments, just the downtime of that. Sometimes patients don't understand how much commitment is required for that downtime. I have so many patients that do body contouring treatments like, Brazilian butt lifts and your, lipo 360s. I mean, I find it's travesty that patients don't get through. Like, honestly, I think everybody that goes for those treatment should go to a depression scale before even being eligible for this treatment, because you can't even sit on your butt for like months. You can't even lie down in certain positions. It's such a agonizing treatment and such a long recovery period. You're going for massages, you're swollen, you don't feel good, you can't move. And that happens with even liposuction underneath your chin. Like the swelling that you have, you can't move, you have to massage every single day. So all of these treatments come with so much of that commitment and the downtime. And I feel like sometimes, some of my colleagues in plastic don't do justice because they don't talk about some of these treatments or what happens after the treatment the next day. They're so quick. And, I have some friends over here. I think they're great. They're excellent. But sometimes, honestly, like, I have a lot of patients that went to like Miami area and stuff like that. Over there, they treat people like just a machine. Like they will kick you out right after the surgery. They will have you on your wheelchair. They'll get you out because as soon as you're done your treatment, they'll get you out. And there's no connection afterwards. And obviously, some people even go outside of the country to do these treatments. So when you think about some of those kind of, things that involve with plastic surgery versus aesthetic medicine, you do it, it's temporary, you're here. Sure, you might bruise up a little bit for like few days, 5 days, 10 days. I've never had somebody that bruised up for over like 2 weeks. I've never had anybody that had a permanent side effects on your treatments. Now, can it happen? Sure, 100% it can happen. But the risk of that, it's so limited. And obviously the injector that you're going to will dictate that risk. Some of it may be dependent on you, but a lot of it is dependent on who you're going to. This is where, you brought up something very initially when I talked about myself and my background is in this industry where you're seeing so much just a boom of plastic surgery or medical spa spaces. I would Paramus, New Jersey is considered the mecca of plastic surgery in New Jersey. If you come over and type in Botox near me, you'll find like 25 places. We are rated #1 all across New Jersey for a reason. It's because of the training that's involved to practice in my practice. Versus some of the other practices, you can take a weekend course, you can go and do these treatments. So it just changes the game, and it's important that who you go to, because your results will be so much better along with it. And none of these treatments has to be with a lot of downtime with that treatment as well.
You touched upon something that we had spoken about off the air, and I'm so glad that you mentioned it, is the fact that there are so many options in New Jersey, especially where we live, North Jersey, New York City, tri-state area. And just like you said, anyone could sort of get this quick certification to do it. So as a patient, you want to go to someone who's experienced. Because I've definitely tried around and I've gone to places where it wasn't an actual doctor doing it, nor someone who is that experienced. And the results did not equate to the results that I got working with you. So I'm glad that you touched upon that, because I don't think like the general consumer realizes that some of these people it doesn't take them that long to be able to get certified to do this. And they're out here doing shoddy work. And now those people come to you because they need it fixed.
Right. No, I dissolve and I see so many complications from other, other people that come from different practices all across New Jersey and New York area. That it's unbelievable what's happening right now. New York, honestly, is a wild, wild west. Like it's a complete wild, wild west. New Jersey is a little bit, but New York is so much worse over there, where you have no idea where you're going to. You have med spas that are operated by people that shouldn't be in the business, that are sometimes not. See, for you to practice an injection, Botox injection is a medical product. For me to get Botox, I have to get an FDA approved Botox. That means I have to submit my DA license. And for all of that, I had to go to residency, medical school, fellowship, and everything else involved between it. I had to do all of that to be able to get Botox. Now, somebody can get a Chinese Botox, like from China, straight from China. Yeah. And there are practices that are doing that. Somebody can get fillers in a similar sense as well. And there are practices doing that. Now, fortunately, if FDA does find out, they can be in prison for 7 to 10 years. And there are cases about that. You can look it up on news. There are a lot of people that have been done that. Unfortunately, they just aren't looking. So unless someone goes and tell them, FDA is not out there looking for it, or it's even the state of New Jersey and New York isn't going around and looking for these practices to see what happens. Now, what happens right now is most of these practices are, sure, you have these almost like illegal practitioners that are doing it, and they're doing the hyaluron pens, which is FDA blacklisted, but people are still doing it. And you have other people that are doing injection. They shouldn't be. They're not licensed to do. Even on the licensing side, it's a weekend course. I mean, you go over the weekend, you go Saturday, Sunday, and you come out and you start doing the injections the next day. None of my injectors practice that way. Almost every one of my injectors go to a thorough process of almost like a residency type program where we train them, we grow them, we really, cultivate them to be able to do these practices in a great fashion. Now, do I think every practice is like that? Absolutely not. There's some incredible med spas all across New Jersey and New York as well. But there are a lot more that I'm seeing again and again that are people that just don't even know how to do this. They'll ask questions on Facebook groups on how to do this. They're YouTubing on how to do this. And it's not a joke. And I say this because I'm honestly hurt every time I see that. I've even had people that have come up to tell me that sometimes I do like Instagram lives. I'll do my injection techniques over there. People are watching my techniques and learning from Instagram live. I'm like, that's not an appropriate way to treat a patient. Like, no. I'm doing this after going through residency, after going through all my education. I felt comfortable being able to do this and train this to all my injectors, but that's not an appropriate way to treat it. Unfortunately, there just isn't that that kind of education out there. People are just graduating, whether it be nursing school or PA schools, and just gotta go and doing it without having a proper education behind it, unfortunately. And again, it's not to say that I don't have great colleagues that are doing an amazing, amazing job at this, because I do. I have physicians, I have nurse practitioners, nurses, and PAs. I hire them as well, and they're amazing at doing these. But a lot of times I'm seeing more and more, they're not well trained to do this, and there's complications that come back. What's basically happening is that they're treating you as a dummy patient. They're experimenting on you, which absolutely is not okay, but they don't tell you. So I tell my patients, you should be educated. You should feel very, you should ask your injector, how long have you been trained for? Where did you get your training? Why do you do this? How do you do this? So on and so forth, because it's important that you feel that comfort when you're getting injected, because people don't know what's going on. They really truly don't. And patients should feel comfortable when they go to a med spa, they go to medical practice, that they feel comfortable and like they feel like they're getting something they trust. They shouldn't have to worry about some of this stuff.
No, you're absolutely right. And you touched upon so many points, and I'm glad you went in depth on that, because that's something that no one knows about. No one knows that, some people could just do a weekend course and boom, they're injecting you. And that's why you have all like shoddy work. Like,
sure.
A friend of mine was just telling me last night, she got Botox recently, and by someone and who they don't even specialize in cosmetics, but they got, you know, whatever they needed to be able to do it. And now her one eyebrow is off. So
And
I'm like, and she's like, I'm gonna start going to the people that you go, and I'm like, yeah, good idea, because there's a lot of that out there. And then as far as New York knows, I know that the laws for New York in terms of being able to do this stuff are like so like loose. They're
yeah.
so loose. And I remember hearing about that a couple of years ago. So thanks for shining light on that.
Well, I can you still hear me because I'm getting another call on the line.
Yeah.
Okay, so you can still see me and hear me, right?
Yes.
Okay, perfect. So, I think with New York, it's just not that the laws are loose, which it is. It is a little bit, but they just don't have enough resource to hunt down people that are doing this illegally. Like it's straight up, that's what it is. It is illegal practice of medicine. If you were to report them, like they would be, fined and jailed for up to 7 years from being able to do this. Unfortunately, people don't realize when they go to practice that are having this, or they get a great price and they're just very happy with it. Now, what happens with that, right? Why is it important you go to the right person? Sure, the droopy eyes and stuff like that, those are sure, those can, yes, you live with it for like 3, 4, 5, 6 months, and then, if you're okay with it, that's the price that you paid. But you know what? Some of this could have permanent side effects. Now, I said that in the beginning of my conversation, where I said, like everything that I do has temporary results, but it can have permanent complications. Now, have I ever had one? Absolutely not. I'm praying to God. Can it happen? 100%. It can happen. I'm not claiming that I won't ever get a complication or it can't happen. But what I'm saying is that the person that you go to will dictate that. The more skills that they have, the more they're able to dictate some of those complications. All my injectors are trained to do that way. Now, what do I mean by permanent complication? One of the biggest side effects that can happen is something called occlusion. A filler can go to an artery or vessel and they can block that vessel. If it blocks the vessel across near your eye, you can go blind. If it blocks the vessel near your nose, it can, cause necrosis. I mean, you can occlude it and that whole tissue dies. And that can happen in any area across the lips and so on and so forth. So when I talk about this, like I see a lot of people that are practicing this, that are getting consults on social media, and it truly does happen, that shouldn't be practicing this type of medicine, and they're trying to find out how to deal with some of these complications on social media while the patient is on the chair. That is not okay. So that's the thing, risk that people should be aware of, because that can happen.
Yeah, it is. And that's why you want to go. Great point. That's why you want to go to someone who is an expert in the field and who specializes in it, because this is promoted so much that people are so unaware of the side effects that they could potentially encounter if they go to someone who doesn't exactly know what they're doing.
Yeah. 100%. Sorry,
Now,
Mike. I don't know what happened. My voice went away. One second.
It's all good. I'm getting over. I've been sick the past 2 weeks. Today's like my first day doing okay. So
give me 1 second. All right, I'm back.
Okay. So now that we touched upon like the more serious subjects, I want to sort of go in depth into all the cosmetic procedures you offer. I have the little menu here. So I want to go down the list, and first I want to start with the basics. Wrinkle relaxers. People typically refer to Botox as like the only thing that could treat wrinkles, but there's variations now. There's Botox, there's Disport, there's Xeomin, there's Jeuveau, and there's the latest Daxxify. So if you could you explain the difference between all five?
Sure. By the way, that's great that you know all of them, because obviously most people don't. So whoever educated you on that is amazing. I'm joking. That's me. But I'm just joking. So listen, being honest, all of them are botulism toxin. They're all botulism toxin type A. The variation comes with the, some of these are older, some of these are newer. It's like comparing iPhone 1 versus iPhone 14.
Yeah.
None of them are bad. All of them are great as long as they're FDA approved. You can get, like I mentioned, products from outside the country, and there are people that are doing that. As long as they're FDA approved products, they are good products. None of them are bad. Now, clinically, I like to choose some products over other because it makes sense to me. Some of the products have really, really great results. So Botox, Allergan Botox, everybody knows about. That's the one, it's like a common household name now. That's been around for like 30, 40 years. Technology and science have changed a lot in 30 or 40 years.
Yeah.
If I told you to use the iPhone 1, you will probably hit me with that iPhone 1. It's like brick, it's like a calculator now. I'm not saying, and again, I'm not trying to compare apples to apples or, in this sense, but technology has changed a lot. So what used to happen with botulinum toxin is a very unstable molecule, so it needs a lot of accessory proteins around it. Some of the newer molecules are considered a much more highly purified form of botulinum toxin, so your risk of building resistance is limited. You're getting a much more natural toxin. You get much more of a natural results behind it. The biggest model that we have at our clinic, and I should say this, like we have a 5-star rating across 3 or 4 locations with hundreds and hundreds of reviews. And the biggest reason why we have that is we believe in naturality of results. The way I'm able to do that is by partnering with brands that create natural results. I don't partner with brands that do not create that. So going back, one of the biggest things that I use at my practice is something called Jeuveau or Daxxify. These are very, very natural toxin. I still use Botox as well, botulinum toxin. I don't typically tend to use as much Disport or Xeomin, and their reasonings behind it clinically. And because I use Jeuveau and Daxxify, these are much more natural. They create very, very nice results, and they last for a very long time. And people appreciate that they're still able to have a little bit of movement, but nobody is ever able to tell that they had a Botox in the forehead or they had a wrinkle relaxer in the forehead or frown line or crow's feet. And that's what you want. Nobody wants to look like, somebody that got stuff done. And I see that, again, I'm at Garden State Plaza. I walk around this mall sometimes and I see some people, I'm like, oh my God, like what's going on, right?
Yeah,
Like,
I know, I've seen it too.
and it doesn't have to be that way. And part of that, I blame the injector that's doing these treatments. That's not necessarily the person. It's the physician, it's the nurses, nurse practitioners, the PA that are doing this treatment, because that education isn't there. What is the normal and natural results? And we are committed with providing that. We are very, very, we have our consultation assessment. We take a very long time about doing those to make sure people do appreciate what the naturality results are. We're very, very committed with that.
So you made a couple of good points I want to touch on because I know as a patient, I'd want to learn more. So Botox, it's been around forever, and it's almost an antiquated product for some, especially with resilient muscles, because there have been all these other products that are released there after the fact that are more effective than Botox. At least for a person like me, I got Botox 3 times and then I was just done because every time I needed a touch up, and even after the touch up, there was still a lot of movement. It just doesn't work for me. Do you find that Botox in general is a bit of an antiquated product, or is it just not strong enough for men or those with strong muscles?
Well, I don't think it's that. I don't think it's that it's strong enough, not strong enough for men. And I also wouldn't say it's like completely antiquated. It's still a good product. People get great results with it. I think what I find with botulinum toxin and Disport is data that is presented, and that the risk of resistance is a little bit higher with some of these products. That means the more
specifically,
right? I'm sorry.
The risk of resistance is higher for Botox and Disport specifically.
And Disport, yep.
Okay.
Compared to some of the other products because of the accessory proteins that I had mentioned earlier. The more times you get it, it's almost like thinking like a vaccine, like getting immunity. You need more and more just to get that similar results over there. You have beautiful results. And does it happen for everyone? Absolutely not. And I'm not saying that it happens for everyone, but there is a good fraction of population that happens to. For me, I'm like, why, so when we first started practice, I thought to myself, most of my population is a millennial population. We have a huge number of millennial population. I'm going to be growing old with them for a very long time. I want to be able to provide toxins that are much more natural, that are much more cleaner. They're purified form of botulinum toxin, so I don't have to worry about some of those negative side effects, right? And also the results itself. Sometimes I don't get similar results with Disport and botulinum toxin that I'm able to get that with Jeuveau or Daxxify. That's that's what it is. And Xeomin is a very, very clean product as well. It's a great product as well. It's just, again, not one of my favorites because the molecular weight of the Xeomin product is much more weaker than some of the other products. It's like I have to do a little bit more to get the same results as Jeuveau and Daxxify. So it doesn't make any sense to me. So, again, these are all clinical decisions that I partake in, I make for my patients because I have the understanding and knowledge to make sure I do the right by my patients. Sometimes I find that some practices do not do that because they care very much more about, marketing that they get from X, Y, and Z company.
Yeah.
And I could care less about that. I care about my own patients because I know that patients will come as they experience the results. And that's what my brand has been built on, of those results, those patients that are satisfied with the results with those treatments.
And isn't there also a risk with Disport that it migraines? Doesn't Disport have the highest chance of migrating?
Sure, 100%. So Disport is one of the molecules that has a much more of a widespread. Now it's good and bad. If
Yeah.
you have if you have a wider forehead, that's great for you because it's going to shine a lot more. Bad for you if you have a shorter forehead. But if you're a practice that only offers Disport, then you're SOL, right? So you're going to get a lot more of those complications, unfortunately. Again, great product. If you have a good injector, how to use it, you'll have great results. If you don't have a good injector, doesn't know how to use it, then you may not get good results with that product. So it's, a lot of this has to go around with some of, other external parameters over there.
And Xeomin, I know it's a more pure formation, but like you said, it wears off quicker. And that's the only one that I encountered where I sort of felt my head felt heavy after the fact for 2 weeks.
Even
So
like a head.
yeah, like almost like a low-key headache, but it felt like heavy. It was weird. That was an interesting one. But yeah, so most recently I tried Jeuveau. I like it a lot. I didn't have any of that weird headache feeling after the fact, and also I felt like the results did set in quicker.
We actually did Exosomes Jeuveau with you, which both Daxxify and Exosomes Jeuveau are the only compounds that we can do this with, which now you have toxins that can last 6 to 9 months, so double the duration of time. One of the biggest things I used to hear from my patients all the time is like, they will come back like, I love the results of botulinum toxin or any of the neurotoxins, but I just hate that I have to come back like 3 months, every 3 months, every 4 months. So you do have an option now that you can last the results. I have patients that come back in 7, 8 months, and it kicks in much faster. It kicks in within like a day or two. Even just regular dose Jeuveau, it's actually one of the fastest, neurotoxin that kicks in. I literally call them a weekend toxin. Doesn't matter what day I use it, it works in by the weekend. So I can use it on a Thursday, it works in by Saturday. You're good.
And I know there's been studies recently about Jeuveau. When they give extra strength Jeuveau, which is basically double the dosage, like you mentioned, it lasts just as long as Daxxify does.
100%. And there's actually a paper that was recently released just within this week, earlier this week, just talking about that. It is going through trials. They're going to publish it for a more general population. But I've been one of the only practices in all of New Jersey and New York that I've been doing that similar dosing and similar protocol for the last almost a year now. I'm in touch with the medical affairs department, with the clinical director at Evolus itself, and I've had great results with it. And something I can't speak more of because I've had amazing results with both Daxxify as well as Exosomes Jeuveau clinically.
Yeah, and I love the extra strength Jeuveau. It's right up there for me. I have Daxxify is the only one that I haven't tried yet, but I'm eager to try that one. So Daxxify, this product sort of differentiates from the others, or at least initially upon release, because it's able to last double the time of Botox, Disport, Xeomin. Now, why is that?
It's it's considered as a vegan toxin.
Okay.
So it really doesn't have any protein attached to it. Most of these products have some kind of albumin or a protein that we get from eggs and chicken and stuff like that. So that's usually attached with most of these products. Now, part of it is that there's technology behind it that they have developed to be able to do that. And other part, honestly, is the dosage. In medicine, dosage is what determines duration. So it typically ends up a normal dose of extra strength Jeuveau or even Daxxify and stuff like that is about, for these 3 areas. So FDA indication, let's talk about what an FDA indication is for a normal dose across forehead, frontline, and crow's feet. That's about 64 units of botulinum toxin or Botox.
Total.
Indication for Jeuveau, FDA indication for Daxxify for just for this area is about 40 units, just in the frontline area over here. So it's a much more of a toxin. So I've talked about Exosomes Jeuveau, how they went with the trials on what to do for the forehead, frontline, crow's feet, and typical doses over there is about 120 units or so. So almost double the doses. Obviously, double the doses will get you double the duration of time. Now, the difference is this. What happens if you do double dose with Botox, just regular Botox? So there's actually studies done on that as well. That shows that at a certain point, doesn't matter how many more you do, it doesn't work longer. But with some of these newer compounds, the formulation is very different. How we mix it is very, very different. And with that, we do get a longer duration of action. So yes, there is science involved in it. There's difference of formulation. There's different of techniques on injecting itself, and you do get longer duration of action. If you were to do like 120 units, just regular Botox that we're talking about, you will just be shocked for for a very long time. And you obviously don't want to do that. So you can still get very natural results like you right now have Exosomes Jeuveau. I'm confident when people look at you, don't think you have botulism toxin in your face or neurotoxin in your face, right? I mean,
Yeah,
correct me if I'm wrong.
it just looks more youthful.
Exactly. It just looks more lifted, more youthful. It looks very natural. That's what you want to have. And that's what some of the newer compounds are able to provide that.
That's good to know. I can't wait to try Daxxify. I'm happy with Jeuveau. I like Jeuveau better than the other three. So I'm excited to try Daxxify next. Now, moving on to fillers. So correct me if I'm wrong, there's Restylane, there's Juvederm, and there's RHA. Are there any other variations, and what are the differences between those three? And most importantly, what areas on the face could people use filler for? Because I don't think everyone knows what you could use filler for and how you could contour your face and change your face dramatically without, getting this sucked or this cut, etc.
100%. Honestly, both Botox and fillers, you can use it all across your face. I don't think there's any area that I can't use Botox in across the face. I don't think there's any area that I can use fillers in across the face. You just have to know how to use it. That's the bigger conversation to have. With fillers, there's actually multiple different lines of fillers in America that are FDA approved. Obviously, you hit on Restylane. Juvederm is one of the biggest one. RHA is one of the newest one in the market. There's also something called Revenus Lips. That's a different company that makes that. There's Bella Toro as well. So there's multiple different types of fillers. They're all hyaluronic acid filler. So they're all hyaluronic acid filler. Our body naturally has hyaluronic acid in our body, and that's where they're able to kind of use it biostimulantly and use it into a filler, basically. So they're all hyaluronic acid filler, but what differs between each is the technology that's there. Some of them are very thick, some of them are very thin. Some are bonded very strongly, so it lasts for a very long time. Some are very sticky, some are very loose. Why is that? Because different areas of our body, different areas of our face will require different types of filler. The fillers that I do in the lips would not be the same fillers I do in my under eyes, because you will not get great results over there. So the companies have different technologies. Juvederm, Restylane, and all of these companies do have different technologies. My favorite one to use is RHA. That's the same company that makes Daxxify. And actually, we were talking about Jeuveau and Ebelis. They actually are coming up with their own brand of fillers from here. They're coming out from Europe next year. But so RHA is my favorite ones to use. They're the #1 filler in Europe. And it's because of the naturality of results. Again, I go back to the same topic because they're much more softer. They are known as a resilient hyaluronic acid. Resilient because it lasts a very long time, and they're one of the strongest one, but they always provide very natural results. They're very dynamic. So just to go back, you asked about where I could use, fillers in. You can use fillers across the forehead, across the frown line, if you have deeper frown lines and stuff like that. I wouldn't recommend you go to anyone. I would recommend going to someone who's highly skilled to be able to do that. We talked about some of the risk involved with fillers for that, right? Blindness and everything else. You can do fillers across the temple area. I do a lot of these. You can do fillers across underneath the eyes to get an eyebrow lift as well as underneath the eyes. You can do fillers across your nose. You can do fillers across your mid-cheek. The nasal labial folds, the area, the smile lines that people call it. You can do fillers across that area. You can do fillers in your lips. You can do fillers in your jawline. You can do fillers in your chin. So you can literally do fillers. So there's not a part of my body that I mentioned you can't do fillers in. There's literally every single area that you can do fillers in across our body.
That's very impressive. That is impressive. I didn't even know you could do the forehead. I didn't even know you could do here. So
Earlobes, sometimes people have like bigger earlobes and stuff like that. I do fillers across that area. So all of these areas I do fillers in across this area.
and I don't think people realize that there's such a thing as liquid rhinoplasty. So could you explain what that entails? Because it's almost like a temporary nose job for those that don't want to go under the knife, and rhinoplasty is an extensive surgery. So could you touch upon like liquid
Sure.
rhinoplasty?
100%. So, rhinoplasty obviously is surgical. I have some great friends that do it, plastic surgeons that do a very, very incredible job, transformative results. Honestly, again, going back with the advent and innovation of fillers, you're able to do these procedures. Again, you have to make sure you go to a skilled injector when you're doing this because of the risk that's involved with some of these procedures. With liquid rhinoplasty, I can have great transformative results within 10 minutes of time. There is no anesthesia involved. People literally come in during the lunchtime to me. They do the results. We see the before and afters. Has a beautiful, beautiful natural before and after. They last for 12 to 15 months period of time. They're done with hyaluronic acid filler. And I should have said this earlier. One of the beautiful things about hyaluronic acid filler, any hyaluronic acid filler, is completely reversible. You can actually use an enzyme called Hylenex or hyaluronidase, and you can literally dissolve the whole filler if you want to. You can literally get rid of the whole filler if you want to. Now, it's very rare that I've ever done that in my whole career. I've probably done that once or twice my whole life because of a result, something like that. That's very, very rare.
Yeah.
My practice, I literally do it at least once or twice a day because I saw somebody else that had gotten the filler. Because they come from a different practice, they have gotten under eye filler or lip filler, they got those lumps and bumps, and it just migrates out like completely because it wasn't the right filler for them. And I'm sure a lot of your viewers and listeners can attest to that. That may have happened to them as well. That's not something we do over here. That's not something we do at Hello Hydration, and it's because going back, the injection skills matter, the type of fillers that matter. But going back to your point, liquid rhinoplasty can have amazing results and very transformative results in a very, very quick fashion. And within 10 minutes, you can see what the results are. I have a lot of before and afters on Hello Hydration, as well as my own account, which is at Lift by Dr. Tameem. Lyft as in Lyft. So if you think Uber, just think about Lyft. I did it for that reason because you can either call Lyft or you can just call me up basically.
I like that. Now, my own, just to use me as a personal example. So I got months ago in the summer, a little bit of filler in my cheeks and a little bit in my chin. And it looked good initially, but I think that was just the swelling. And then I found out when I went to you that to do my cheeks, my chin, and my jawline, they only used like 3 or 4 syringes. And you're like, I use 5 on the jawline alone. So I think it's important people know that depending upon the area of your face, you may need more or less.
100%. So like the usual idiom in life, if you're doing results for, as we aging, obviously we age, we lose about 1 to 2 syringe of hyaluronic acid from our face and collagen from our face per decade of life. So 1 to 2 syringes. So if you're just doing fillers because you want to look refreshed and you want to look rejuvenate, and you're just doing as a replenishment, then you talk about 1 to 2 syringes for each decade of life, just to have an idea.
Yeah.
Now, if you're thinking about aesthetic results and we're trying to contour jawline, we're trying to contour chin, then obviously I may need a little bit more because I'm trying to aesthetically design those results, and I may have to layer some of these fillers. Some fillers go really, really deep, some fillers go really, really superficially. And you can have transformative results, but it all requires what I'm able to do with what I'm given, basically. Do you understand what I mean? Like, obviously, plastic surgery, you see those before and afters, they have beautiful before and afters because you go under anesthesia, you have such a huge downtime, they break the jaw, they sculpt the jaw afterwards. I can do very, very similar results that last for 15 months, 18 months, up to 2 years with Volux. Juvenile Volux, one of the newest fillers out there, has amazing results. Such a thick filler. It really contours your jawline. It's a beautiful filler for that area. And we use that for that area because that's what it dictates in that area. Sometimes I do that and I'll go in superficially and line it up with something called RHA4. I've talked a little bit about RHAs, why I love those fillers over there. And then with compounding those results, I get beautiful, beautiful natural results and very nice results with it as well.
I like that. And that's why I'm currently excited that I'm getting my face tightened, and the little filler that I do have is being melted with the microneedling, because we're going to go back in and redo it all anyway.
So we talked about doing RF microneedling. You recently had your first treatment of RF microneedling.
Yes.
And that's honestly a conversation that a lot of people should have, especially as we're approaching that, holiday season, and people are at dinner table are talking about like, oh, I want to look good. What do I do at the turn of the year? What do I do for Christmas? What do I do for holidays? Radio frequency microneedling is a great treatment to be able to do. And I'm sure a lot of patients have, or people have heard about Morpheus and Lutronic and Scarlet.
Yes.
That's what radio frequency is. Radio frequency is heat along with microneedles that helps us create a lot of collagen, a lot of elastin, and it lifts us. It's literally considered as a mini facelift without having the downtime. Again, going back, being able to do treatments without having to have it downtime, without having to have the blade attached to it and everything else.
Now, I just did my first treatment. I did one a week ago, and I already feel like my skin's like glowing. It was really red the first day, but by the second day, it was mostly all gone, and I love it. So typically you say people need to get a series of 3, and each one is typically 6 weeks apart or 6 to 8 weeks apart between the treatments. So it's a 3 series of RF microneedling. Now, what does this do? Because from my knowledge, I know it tightens. I know it reduces like fine lines and skin imperfections, but I know there's a lot more to it.
Sure, 100%. So, it's one of those treatments that I can actually use it for the face. You can actually use it for the body as well.
Oh, the body. Okay.
100%. You can use it in different areas of our body as well. So radio frequency, you have to think about it, actually is and the microneedling that's attached to it, it's actually one of the deepest treatment that we do. The needles itself go up to 3 millimeter to 3.5 millimeter depth. And along with that, you have heat. The radio frequency actually heat. As the heat is going, you're coagulating the blood, but at the same time, because it's going to multiple layers for your tissues, you're tightening everything up. And you're creating a mechanical injury to the skin. Because of the mechanical injury, your body starts thinking, oh my God, I'm injured, what's going on? Then it sends all these growth factors, all these collagen stimulating factors in that area to help heal that process. So you're deliberately creating an injury in the tissue to start healing that tissue. And when you're healing that tissue, you get a very, very nice lift with it because it's tightening up to what it thinks it should be, what it thinks the best it should be. So it's going to stimulate and give a lot of boost of collagen and create a very nice tightening results with it. So in the face, that's what we use it for that. If anybody wants to know what I do with my patients all the time is I literally put Google and I do RF microneedling before and afters, and I go and swipe the results on Google on images. The reason why I do that, I tell my patients all the time, I get to educate and you get to decide. And I don't want to show my results. I want to show you the results what the technology offers all across the world. And if you think this is a great treatment for you, then yes, let's have the conversation how we're going to do this. But people, when they see the results and before and after, and you can easily Google these results to see the before and after, and you can see how gravitational the changes are in the face because it improves fine line and wrinkles. It improves saggy skin, crepey skin. Sometimes people have acne scars, like deep acne scars. It's improved that. The neck has such beautiful results because it creates a very, very nice lift across the neck. Like the before and afters of that is amazing. I've yet to have one person that ever came back to me that told me that they didn't like the results of the RF microneedling. So I'm excited that you're trying it, and I want to see what happens at the end of that, 3 sessions to see how you love the results of that. I'm confident you love the results of that. And along with those areas being on the face, you can do it on your belly when you have those stretch marks, when you have the loosening of skin, across the arms if you have loosening of skin. So there's a lot of advantages and different areas that you can do these treatments. And the beautiful thing is the next day, you can literally go to work and nobody will ever know you did that treatment because there's no downtime with that treatment.
It's so true. So I got it done last week. So this is being recorded in mid-November. I got it done on a Thursday. The next day was Friday. I was seeing Sebastian Maniscalco in Atlantic City, And the following day was Saturday. I was seeing Nikki Glazer in Atlantic City as well. So I literally got it done, everyone, on a Thursday. And 24 hours later, I was at an event. I was with Sebastian. 48 hours later, I was at another event. I was with Nikki Glazer. So this stuff not only works, but you don't have to worry about your face being red and you having to hide in the house for like a week or weeks.
No, I agree. I 100% agree with you. And that's like one of the beautiful things about the RF Microneedling, that you literally don't have any downtime. By the way, how was Sebastian and Nikki?
Oh, it was great. Sebastian is like so funny. We had fun. Like we were bullshit. I was bullshitting with both of them like before and after the show. I will say Sebastian, people got a dinner and a show because halfway through the show, someone like passed out. And
Oh, wow.
yeah, and they had to stop the show. People didn't know if like they were having a heart attack or like a seizure or whatever the hell. And he handled it well. He got everyone under control. He paused the show. They, took them out. Ambulance came and all that. And then he came back and restarted it up. So yeah, I thought that was like really nice of him. And he was good at controlling the situation. But yeah, he's hysterical and funny as fuck. And so was Nikki Glazer. And Nikki Glazer and I were like actually bullshitting for a while about all things like cosmetic. Because when I interviewed her a couple days prior to seeing her in Atlantic City, we started talking about how this digital age that we're in, thanks to the Kardashians and everything else, just the way society is going, people are so like insecure about how they look. So she was talking about how I'm gonna be I'm dreading when I eventually turn 40. She's like, I'm doing the Botox, I'm doing the fillers, I'm doing this, that. And during the interview, we were talking about like my rhinoplasty, my buccal fat stuff. She's talking about how she wants to do microneedling. So it was a topic during the interview and after the show. In fact, there's like a video that I posted on social that I didn't realize my friend took of me as a joke of me and Nikki bullshitting about like cosmetic procedures. So it was fun, and we got to talk about the same shit that I talk about with you. We're here today.
Definitely. And honestly, and I told you this before, Nikki is one of my favorite comedians. I love her. She's incredibly hilarious. And so is Sebastian. Sebastian is a great comedian as well. But, I think she brings up a good point, if we can kind of talk about that, if you have a few minutes.
Yeah,
which is,
I want to, for sure.
Yeah, the advent of social media and what it has done to us and the perception of reality. And this is, it's good and bad. Obviously, technology has changed a lot. Obviously, some of these treatments that we are doing now, older generation never even thought about doing. They didn't even know. Botox is like a common name now. Like I have patients that are in their 20s, I have in their 30s that have started to do Botox because they want to do preventively, which is good. It's not a bad thing you're doing their prevention, but at the same time, you want to be able to, again, I think it's the job as an injector, it's the job as the person that's injecting you to have real honest conversation about real nice, beautiful, natural results. Now, I'm not a gatekeeper. I don't intend to be, but I think we all have a personal responsibility on the other side as practitioners, at the other side as specialists that are people coming in. Because, you have to recognize that when people come to for treatments, it's a very vulnerable moment when people come in. They're upset about this. They have stuff going on at home. They want to look good because of X, Y, and Z, whatever is going on. And, I think it's important for practitioners to not use social media filters as as an epidemic of good results. And
yes, yeah, it's false advertising. It really is.
Yeah. I've honestly had patients that have come to me with like just literally with the face with the filter, be like, can you make it like this? Or like, listen, I can't. I can do fillers, and listen, my fillers are better than a filter, and I always joke around like that. Do filler, not filter, because you'll have natural results that way. You'll have beautifully natural results that way. But unfortunately, with social media, how it is and how we compare ourselves, it is honestly, something I talk a lot with my patients about, because it can be a slippery slope. It really can be a slippery slope across there.
It's so true. It's so true. And speaking of RF microneedling, when I came to you and I was talking about what I wanted to get done, I was like, they didn't use enough filler. I feel like everything's too subtle. Could you just add more filler, or could you use threads? But what I found interesting was you explained to me that before I even do that, it's better to just do a full series of microneedling, get your face as almost youthful and almost as potent as possible. And after that is when you do the fillers, when you do the threads, etc. So the way you explained it to me, I found very insightful. So could you sort of explain why you want to do this first, then this second, then this third, etc.?
100%. I think that's the conversation I have every day with my patients. You have to recognize that our skin, I wish there was just one treatment that I could do that could fix everything. It just doesn't happen. Our skin operates in a multifaceted fashion. You have skin, you have tissue, you have muscles, you have tendons, you have ligaments, and then you have the bone and fat pads across all of it all. So there's multiple layers of things that are happening across the skin. So what I talk about is if I can tighten, because again, the collagen stimulation that we can get and the tightening of the skin that we can get, the tightening of the results that we can get with the RF microneedling, and a natural at that, because you're only stimulating your own natural collagen. I'm not inputting anything into it. I'm not doing anything to it. So I'm just naturally stimulating that. And when you get the nice lift from it, that's when you go back and place a little bit of filler, that's when you go back and you place a little bit of PDO threads, then you have beautifully natural results that can last for years and years to come. But again, it requires a method of multitude of treatments and a multi-treatment. So instead of doing one of everything, you can do a little bit of something. And the little bit of something will attack multiple layers of skin tissues and skin structures and across the face. And that's what you want to do. So you had asked me, it's like, oh, why not just do some threads right now? And I've been, I talked to you very honestly. I was like, listen, you have some volume loss. If you have volume loss, what are the threads going to pull? Nothing except skin, and you might get dimpling because of that. Now, when we lift the skin up with RF microneedling, we stimulate the collagen, we add a little bit of fillers, and then you do threads after that, you have the collagen that is lifting, you have the collagen stimulating, and as well as the volume from the fillers, then you can get a very nice natural lift with it. And that's what has been a successful kind of outcome with a lot of my patients, not all my patients.
And it makes sense. And I love the way you explained it, because it made me realize, oh, it's not just like a one size fits all. It's just not, oh, I got botchy filler, let's just add more to it. It's like, no, let's sort of go back to the drawing board and make it as perfect as possible, really.
Yeah, no, 100%. And it's just about doing little something every time. It's a concept. Art takes time to build. Science obviously gets perfected, but art is not created in one day. It's created in a slow fashion. And what I practice is art. And I take time when I practice that. I'm very judicious. I'm conservative. I'm bullish when I need to be. I'm conservative when I need to be. And at the end, I want to create a natural, beautiful art piece at the end. And I do that every single time. And I'm confident and I'm comfortable with doing that every single time.
And I like what we're doing, because after rhinoplasty, I had a big cyst on this side of my nostril, so they had to cut it and remove it, but I had a scar after the fact. And I've been so self-conscious about that. So the RF microneedling will tackle the scar. And then and then I had buccal fat surgery, and I'm glad, because I had really chubby cheeks here. But now I have like this little extra skin because of the buccal fat. So the RF microneedling will produce more collagen, and then the PDO threads will tighten and lift it. So there's a method to everything. It's not, you can't just get one treatment and think it's going to fix everything. So,
well, it's funny you mentioned that, because sometimes I'll get patients, they'll come in, they're like, oh, just do Botox and, oh, it didn't improve. I'm like, well, yeah, because sometimes the lines have gotten so deep, then Botox is just not the only solution, or any neurotoxin is not the only solution. When things have gone to the point, when they have damage to the point, then you can't just do one treatment. You have to do multitude of treatments. Unfortunately, I wish I could just do that with one treatment. It's not a magic wand, right? And by able to do it in multitude of treatments with natural results, we're able to give nice results that people are very happy with it, and they're comfortable with it. So many times I hear from patients that come back, they've done treatments at X, Y, and Z practice, and they come back like, wow, I didn't like how I looked for X, Y, and Z period of time, 3 months, 6 months. And you don't have to do that if you can do it a conservative, natural way. And that's something I'm very big on. Again, I do this every single day. We do this every single day. We have beautiful transformational results. If I have a patient that's young, in the 20s and the 30s, and they want to have a nice, beautiful, voluptuous lips. Yes, we can do that, but we can still maintain the naturality. At the same time, I have patients that are 50s and 60s that want to have just a soft results and soft transformation. We can still do that by maintaining the naturality of that.
Now I want to discuss PDO. I want to discuss actually Kybella too, before we get to the threads. Now, when I got buccal fat surgery, that was fucking rough. Let's call a spade a spade. Now, I was thinking about doing chin, neck, and jaw lipo, and I'm afraid to go through with that because I know what it entails. But I don't think many people know about Kybella, and that this injected just a few times does it permanently dissolve the fat?
Yeah, 100%. It actually completely dissolves the fat. So there's two ways to destroy fat. One obviously is liposuction, which is surgical. You go under anesthesia. You're swollen for up to like 3 to 6 months. You might actually even have a little bit of numbness and tingling across over there. You have to do some lymphatic drainage as well, and obviously it costs like $5, $7, $10,000 depending on how you go to. The other way you can do that is non-surgical with injectable. You can literally inject with this compound called deoxycholic acid. It's actually something we produce in our own body, in our bile, and it emulsifies the fat. That means it kind of destroys the fat. Once you destroy the fat, it's gone forever. You actually can never get fat cells back. They don't come back. They're destroyed forever. So it doesn't matter if you gain 100 pounds or lose 100 pounds, it's gone forever. Now, the only thing about Kybella or any type of deoxycholic acid treatment, it does require a multitude of treatments, at least 2 to 3 treatments and 2 to 3 vials of treatment each time. But you have, again, very, very nice results. There's some swelling involved with it, but you still have very, very nice results that you can compare them before and after, again, without having to go under anesthesia, without having to go under surgery for those results.
What is the time between each Kybella treatment, and how bad is the swelling?
So swelling, repeat that question again one more time if you don't mind.
What is the time between each Kybella treatment? Is it similar to microneedling in that you get one, you wait 6 weeks, you get another, wait 6 weeks, get another?
About 4 to 6 weeks, you're absolutely correct. And the reason why we do that, honestly, is because you need time to heal, you need time to recover. And you want naturally for these cells to absorb some of that swelling, some of that, with Kybella I'm talking about, you want your own natural lymphatic ducts to do the work that it's supposed to, which is take away all that dead fat cells that are there. So it does take about 4 to 6 weeks. We see patients about 4 to 6 weeks. Whenever they have done the trials, they've done it about 3 different treatments, 2 to 3 vials of treatment each time. I have practices friends that I know that that do this. Sometimes they do 4 ml of vials each different time, and some practices do a little bit less. But either way, you come back 6 weeks apart. There is swelling that's involved, so you do get a little bit of swollen with it. That can last for up to like a week or 2 weeks. Now, we at Hello Hydration, we actually do it a little bit differently. We actually compound our deoxycholic acid or Kybella with something called phosphatidylcholine. Okay. I'm never going to spell that for me, so don't worry. Yeah. It's called PCDC. So just to make it simple, it's PCDC. DC is the deoxycholic acid and PC is the phosphatidylcholine. The reason why I do that, clinical research has shown Kybella tends to have a lot of swelling and a lot of pain with it. The PC component of it, whenever you compound in it, it decreases swelling by about 55% and decreases the pain about 80% or so. Oh. So a lot of patients, when they do this, I mean, it's just swelling above 100%. There's a little bit of swelling above, but not as bad as I used to get when I just did PC or DC, like called Kybella. So I'm able to compound that to really, again, for having the best results for my patient, because clinically is what makes sense for me to be able to offer that treatment for my patients.
And after the fact, are people able to, it doesn't affect their breathing or their eating, right?
No, there's actually never a data set to prove any of that or show any of that, because it doesn't go that deep into it. So yeah, no, it doesn't affect any breathing or anything like that. Now, what can happen is you might get a little bit of numbness and tingling across this area. That can actually last for up to like a few months. But again, those are temporary results. Those are temporary thing that always goes away. The reason why that happens because fat cells tend to swell up a lot. If it swells up, it can block some of the nerves and compress some of the nerves. When the fat goes away, you get the function back. Simple as that.
Okay. All right. So this is that's a very safe alternative. Everyone wants a snatched jawline now. Everyone wants to be snatched with a jawline. They don't want a double chin. People used to just worry about their face. Now they're worried about their neck area too. So this seems like a great alternative to chin, neck, and jaw lipo.
Yeah, 100%. And it's a quick treatment. It's an office treatment. I do this within few minutes. It takes me like less than 10 minutes to do. You don't have to go under anesthesia, and it's not painful at all. And again, the concept of this talk was just discussing some of the treatments that are offered without having to undergo anesthesia. And you can see how vast array of medicine that's out there that you can do without ever having to go under surgery.
I love it. And I'm sure many people watching and listening are like, oh, wait, I could do this without having to go under and take off of work and need like someone to pick me up. And well, you know what I mean? This is awesome.
I'm going to change my angle a little bit just because I have to charge my phone. So don't mind if I do that.
No, I like it. I like it because we get to see the glowing lips in the back.
There you go. Honestly, that's the reason why I did it.
The glowing lips. I can't wait. I can't wait to get lip filler. I've done lip flips, which are people hype up lip flips. I think it's no pain. It's like it literally feels like a brief pinch for like a couple of seconds. But filler, I've actually never gotten done on my lips. I'm not ashamed to admit, I don't know where it is, that I do use a lip plumper. So I'm looking forward to getting filler here and to stop using the fucking lip plumper.
The beautiful thing about lip fillers is just kind of going back, lip plumpers, you obviously have to use it every couple of hours. What are those ones I have patients that talk about all the time that like tingles, and you kiss somebody and then they can feel the tingling sensation for like 20 minutes.
That's this one.
That's funny.
This one on the market. It's by Too Faced.
Too Faced. Okay.
Yeah.
So the beautiful thing about lip fillers is, again, naturally our lips have hyaluronic acid. We're only replacing whatever we have lost as we age, because we always age, and we're able to replace that. That can last for up to 9 months to a year. Now, there are some fillers that can even last longer than that. I typically at our practice don't do those fillers because they tend to have a lot more post-inflammatory side effects and complications. So we are selective with the type of fillers that we do at this practice to make sure, again, to have a natural results. You can still have voluptuous results if that's what you want. You can have very soft spoken results if you want, but that all depends on techniques and the injection techniques and type of fillers that you choose. But the biggest thing is making sure you have, very nice results, that people are happy with those results. And, honestly, at this time of the year, I do more lip fillers than anything else because people get very dehydrated. They get chapped lips because of that. And then once you do it, feel the plump. You feel the plump behind it. So I'm excited to get my hands on you whenever you're ready.
I know. And speaking of I can't wait to do this. And this, I think, is amazing and I don't think as many people know about this, the PDO threads. So PDO threads provide a lift, and it uses like dissolvable sutures, and it tightens the skin. You could lift it. I've seen like before and afters on women and men, and the men I've been like so impressed with that this really changes your whole face. So could you explain how it works, how long it lasts, does it hurt, et cetera, et cetera? Because you're really basically giving yourself like a temporary or long-term facelift without having to go through the pain of getting a facelift. So take it away.
100%. So PDO, so here's the thing. Polydioxylene threads, that's what they're known for. They were initially introduced in vascular surgery. So people, when we do heart surgeries and vascular surgeries, we'll do sutures with the PDO threads because they slowly dissolve in our own body. Not only do they dissolve in our own body, they actually are built to stimulate collagen as well. So with that technology in mind, these threads are now designed to be in the face, across the eyebrows, across the face, in the nose, chin, jaw, even the lips. You can do PDO threads in a similar fashion in similar areas where you could have done fillers in, basically. Now, what it's doing is when you're using for lifting, so there's actually two different types of PDO threads out there. There's something called lifting threads, there's something called smooth threads. Smooth threads are just designed to just stimulate collagen alone, but they're lifting threads that are able to pick up stuff. So very similarly, what we have talked about, you can do across this area to lift this up. Beautiful thing is you only have a small little incision. So it's almost like a needle. So I poke a small little needle, I create an entry hole, and then you can actually do the threads inside over there. It goes underneath our skin. Is it a little uncomfortable? 100%. So what we do at our practice is we numb you. Similar to what we did with RF Microneedling. We should have talked about that with RF, and that is an uncomfortable procedure, right? But because of that, we numb you for about 40 minutes or so. So you have to do that. There's some treatments I numb, there's some treatments I don't have to numb. But again, these are all topical anesthesia, or even like lidocaine, which is injectable, but again, very topical. You're not going under anesthesia or anything like that. So with PDO Threads, I typically numb you for like a little bit. And then after that, you do the procedure. It takes me about 15 to 20 minutes or so max for me to do the whole face across this area. It has very instantaneous results because you literally have threads inside that lash onto the fat inside and lift. So they have threads that literally have these little latches that can go lash onto the skin as well as the fat, and it creates a very, very nice lift. Now the lift from that lasts for about, the FDA indication is about 12 to 15 months. Have I seen longer than that? 100%. I've seen results that last longer than that. I've seen results maybe not last as long as well, but those are very, very few and far between. At any time in life, whenever we talk about FDA indication, I should mention this. What we're saying is that what happens in maybe 99 to 95 to 99% of patients. What happens in 1%, I don't know. Like that's never guaranteed. So yeah, I do have patients.
There's always a gamble with anything,
and
it's just so low,
Right. So, but majority of the time, again, FDA means they have tried and tested, they have went through the regulations, they know what happens consistently with everyone, and you see these results with every single person. So that 12 to 15 months or longer, it's great results that last for a long time. And what's happening is that the threads, they basically turn into sugar molecules and they dissolve inside. But they're stimulating collagen because you're placed in over there with the collagen to stimulate. So stimulating collagen underneath there. So even the 9 months, 12 months after, 15 months after, you see the collagen glow because it's lifting. What collagen basically does, it stimulates and it lifts. One should ask you a question. I probably mentioned the word collagen multiple different times in this conversation.
Yeah.
One should ask the question, be like, hey, if that's what collagen does, why don't I just drink collagen? There's collagen supplements available.
Oh, why yeah. You go to Vitamin Shop, there's like a plethora of collagen supplements. And that's so funny because now I even had friends over the past year that they started taking collagen, and if they think like, oh, if they just like mix a little bit in like a protein drink, it's going to do like some magical thing.
Sure. So listen, I tell people do it. It doesn't hurt, but I'm a physician. My whole background is science. When we talk about science, what are we doing? What is evidence-based? How many people have we tried and tested in a meticulous fashion to make sure we can replicate these results? When you look at the back of the collagen powder, I want you to read it, and it will tell you this is not an FDA-approved treatment. We don't really guarantee what we say we guarantee. That. So what is it telling you? That sure, maybe it happens in 5% of patients, but it might not happen in 95% of patients. But maybe they did their own studies in their own little lab in like 20 patients, and they're like, oh wow, this worked, and they're able to use those marketing for marketing. But when you have something FDA approved, what we're saying is what happens in 95 to 99% of patients. So that's the big difference behind it. And data has shown collagen powder, the absorption of that might not be there. So because the absorption of that might not be there, and there's enough data behind that, then what do we have to do? We are using the RF microneedlings, the microneedlings, the peels, the PDO threads to stimulate natural collagen to help get us the lift that we want to, basically. And this is where aesthetic medicine has shined beautifully, especially in the last few years, especially in the years when people sometimes are maybe afraid about doing fillers as a treatment and don't want to use the hyaluronic acid. You can use some of these treatments to create a very natural results behind it.
I love that. I think the threads are one of the most innovative things out there right now. And like people could use them to get that fox eye. The fox eyes are in, they could get the fox eye. Like you see that we've discussed this, especially after the buccal, the lines here, the nasal, labial, whatever, they could use, lift that up. Oh,
it has amazing results. I do so many fox eyes. People love the eyebrow lifts that I get from them. I just recently had a patient just last week that came back to me like literally, I think it was like 13 months or 14 months. And she still had, because she had a very heaviness, like she had like super heaviness across the eyelid. I actually didn't even do fox eye for her, if I remember correctly. I actually did her whole eyebrows. I did threads across this area and across the midpoint and the lateral eyebrows to create a nice lift. Traditionally, you would have to go for plastic surgery for that. Now, you can do this in office in 20 minutes, and I do a little bit of injection, local anesthesia over here, and we do it, and then patients are super, super happy with it.
That's incredible. I see it's so innovative. And this is like, it just beats plastic surgery because the only other way you could get these PDO results is if you get plastic surgery. So I just think it's so innovative, and I can't wait to do it after the microneedling.
I'm excited. That could be
Share
the
all the
Christmas
before and after pictures and share it because
gift or New Year's gift.
and we went through a lot of treatments. Is there anything that I have not discussed? I think the only thing that I have not discussed is potentially the hair restoration and then some of the health and wellness things you do. So do you want to go into, let's talk about the hair before we go into some of the health and wellness.
Sure. I mean, in terms of hair, as male and females as well, we start losing hair at a certain age. Males tend to go lose much faster. We have a male pattern baldness, which typically happens because testosterone that converts into dihydrotestosterone. There's a little enzyme over there that, some males have a hyperactivity of that. And that's why we tend to lose a lot more because of that. Fortunately or unfortunately, again, there's only so much research and so many treatments that have worked in medicine. Like there's not a lot of treatments that work for hair.
Yeah.
The medications like called finasteride, minoxidil, which is a topical medication. And then when you come into the med spa realm, then you're talking about something called PRP or exosomes. PRP is your own blood. We take it, we mix it, and we get the plasma from it. The plasma is called liquid gold for a reason because it has collagen stimulating factors, it has growth factors, so it has a lot of nutrients, and then you can put that back into your hair to grow those fibroblasts. So hair grows from a fibroblast or collagen stimulating factors, and you're able to do that. So the PRP is basically like a stem cell. It's your own blood, we're getting the stem cell from it, we're putting it back in the hair. That has research behind it. Again, I mentioned there's not a lot of treatments that have proven in research to show hair growth. PRP is actually one of the only ones that I've done that. The other ones are supplemental, like Nutrafol and stuff like that, which I highly recommend if you're going through any kind of hair loss, because if you're nutritional deficit, you're never going to grow hair. So I definitely recommend that. And then there's another one called Exosomes. Exosomes are actually, we had actually given you Exosomes, if you remember, for your face.
Yeah.
On your face. So exosomes are, again, biostimulus stem cell instead of using your own blood, right? So why don't I want to use your own blood? It's logical. If you're 20 versus a 50-year-old, if you drink versus don't drink, if you had a very fatty meal before you came to see me versus you didn't, all of these, or you smoke, you drink, so many factors dictate how our own blood naturally operates, right? So if you're young, your blood is going to be great, but if you're older, your blood is going to be bad. If you come to me with a really bad diet and I do your blood, it's going to be really bad blood. It's not going to be the best blood that I can get. Now, exosomes are stem cells. They're derived from, these cells. And what they basically are honed towards, it's stimulating collagen and growth factors. So it's without having the limitations of PRP, you're able to do exosomes. Now, at our practice, we actually price them similar. I just share the data set with patients. I let them decide whatever they want to decide. I typically have them again, it's easy for me with the job that I do now because Google is so huge and Instagram and Facebook and thing, because a lot of patients have read up about treatments before they have seen me. But a lot of times I just let them Google it, like Google these treatments, see what the differences are, and you get to decide. I'll educate you, but I want you to be the person that's making the decision. So when people are able to make that decision, they're much happier because they feel like they're knowledgeable about the decision because I'm providing the knowledge. Obviously, whatever Google tells you, I wouldn't believe everything Google tells you, but at the same time, I'm here to guide you on those kind of conversation, right? Because literally I went to med school for this, so I have some knowledge about all of this, and I'm able to help you guide that and use Google to our advantage to be able to research behind it. So again, talking about hair restorations, PRPs, Exosomes have been a very great treatment behind it. And the last but not least is hair transplant. So if nothing works or you're just fed up, then you have to go to hair transplant for hair restoration.
Nice. And I think these are all exceptional options because I'm against Propecia and finasteride for the obvious reason. They do cause sexual dysfunction in a lot of men. It's very common. So, and no one wants to have to deal with that and lose their sex life. So these are great options and solutions. And how many treatments do you recommend, whether PRP or exosomes, or is it the same?
So the data suggests about 3 to 6 treatments. Everyone is different. I recommend anywhere from 3 to 6 treatments, 4 weeks apart from each other. You know, and you have really good results with it. There's a documented results, and there's enough papers regarding as well and research wise that shows really good results on it. But about 3 to 6 treatments or so.
It's good to know. And then you also offer a variety of things on like the health and wellness side. So
sorry, I didn't really cut you off, but like that's been a huge kind of thing in medicine. IV treatments, hydration treatments, nutritionally wellness treatments. We even do like Ozempic or semaglutide injections over here as well. You know, all these treatments have been really great because people want something they're able to benefit from. Some, you know, very commonly we are nutritional deficit. Listen, I would be a bad physician if I didn't say the number one thing I ask my patients is diet and exercise. I always tell my patients to please diet. So you should be having a nutritionally balanced diet. I always recommend that. I would also be the first one to tell you, I have a really bad diet because I work a lot. That's just who I am. I'm a workaholic, and I'm sure you are as well.
yeah.
Typically, we tend to be. It's just what med school has done, what residency has done to me. I can't seem to just, you know, even if I don't have something to do, I do something. Like that's just how my body and my mind operates.
Yeah, I'm the same
With
way.
that, food doesn't come the first thing to me, so I'm never nutritionally balanced. And that's when some of these nutritional therapies have been beneficial to me because you can really hydrate yourself. You can use vitamin B12 injections or, you know, vitamin C to boost your immunity up, zinc to boost your immunity up. Or if on the other side, where when diet and exercise doesn't work and you want to lose weight, you can use semaglutide, which is such a big medication out there. And I'm sure everybody has Googled about this and everybody has heard about it, which is Ozempic, Wegovy, Mounjaro, which are all similar but different cousins of medication, similar to botulism toxin we talked about earlier.
Yeah.
Same medication, different cousins of that, with a little bit of variable why one makes sense over the other. But that has been a game changer for us, honestly. I have patients that have lost 50 pounds, 60 pounds, 80 pounds again and again and again. Excitingly, naturally, we have a protocol that we have developed over here. One of the biggest thing I talk about is nutritionally balanced weight loss. So we partner with our patients to make sure that we are having a good diet, good exercise. We're not having a crazy 20 pounds weight loss in 1 month. Could I do that? 100% I can do that with this medication. Is that going to be healthy for you? 100% not. What you don't want to do, and I jokingly tell my patients all the time, you don't want to lose 20 pounds in 2 months and lose half your hair with it. What was the point of that? Because you were so nutritionally unbalanced, right? So you want to lose very healthy weight and slowly. And this is where, again, we come into place because we have 3 different clinics all across New Jersey where we have practitioners that have trained to do this and highly skilled at it to make sure that we are having a very healthy weight loss journey with that as well.
That's impressive, all these results. And it's like you're really a one-stop shop fits all because they could get everything taken care of here. And the results are quick compared to going under the knife. So bravo.
I appreciate that. Honestly, that's something that I appreciate you saying that. That's something I've heard many times from my patients. You know, back in the day, and even at some med spas, you know, you go there, you get X, Y, and Z, you get X, Y, and Z. You don't get a cumulative treatment. One of my biggest goals was to be able to offer everything in one space, and we do that. We do it at a very good job. I mentioned this earlier, and I'll kind of say it again. We are 5-star rated all across our 3 locations for a reason, because we provide quality, educationally backed services with making sure we have compassionate care. We're courteous with their patients to make sure that they understand the treatments they're doing. They're happy with the treatment. One of the biggest things that we do over here more than anything else is education. We let our patients know what's the treatment that we offer, and then let them decide what's the right treatment for them. because there are so many different treatments. I mean, we covered so many different topics. We covered so many different options of treatments over here because there are a lot of treatments that are being offered. And it's important that patients know that what's the right treatment for them. Sometimes the guidance isn't given to them. So I'm so fortunate that we were able to do this talk because there are millions of people out there that are probably going to be listening to this, and they're going to understand what maybe some of the things that they had never known about. So I'm actually very excited. I'm actually welcome any questions that they may have to direct it to my own Instagram or even Hello Hydration or even to yours. But they're welcome to direct questions to Hello Hydration NJ or at Lift LYFT by Dr. Tameem to ask me any questions that you may have. And again, best way to answer these questions will be in in-person consultation because there may be some questions I might not be able to answer because legality issue. But if I can, I'm more than happy to answer this question because I want to have an open, honest conversation with my patients all the time.
Absolutely. And it's been such a pleasure having you on. I think this is really educational and really informative, and it's going to help out a lot of people. It really is. So I'm excited because I see the numbers and I get feedback. So I'm excited for this one to air. And I'm excited to continue taking everyone on my own Dr. Tameem Hello Hydration journey. So I'm excited. Thank you for joining me today. And keep watching because after the new year, we're going to do another episode. So
stay tuned.
yeah. And then in the interim, all these services make a great holiday gift. So
I appreciate that. All of our services are available online, by the way. All of our prices available online. We're one of the only practices in New Jersey that's transparent with all of that. So everything's available online. And again, I do genuinely appreciate it. And I'm humbled that you had me over here. There are so many different amazing practitioners that do this. I'm humbled that you had me over here. I thank you for that. My patients think me of a specialist in this and someone that cares very much about my treatments and the services that I offer. So I appreciate that we had the opportunity to talk about this. I'm excited to continue our journey as well as do this again one more time next year.
Yes, I'm excited. And and whenever I come into the office, I'll be documenting it for people to see. And perfect. I'm excited for I always do before and afters for stuff, but I'm excited for the big after because we took a lot of before photos. So I'm excited for the big after. So thank you again and smile for a photo.
See you next time. Thank you. Stay beautiful. Thank you.
Well, smile because I'm grabbing a screen grab.
Oh, it's no way. Okay, I'm smiling.
So 1, 2, it's going to be a couple, 3.
I'm always smiling, so that's perfect.
Thank you. This was so much fun.
Likewise.
Till next time, cheers.
Cheers.